Hi, and welcome to the Total Knee Replacement Support Group YouTube channel. My name's Tony Maritato. I'm a licensed physical therapist, and in today's video, I want to answer a question that came right out of the Facebook group. So somebody was asking about the risk involved with going to outpatient therapy and if there was any option for in-home therapy and what they should do. They were in a high-risk population. Certainly we know cases are rising. So what are the options? Well, I want to throw out a couple scenarios. So first, if you're here in the US and you have traditional Medicare Part B, Medicare will allow Medicare beneficiaries to receive outpatient physical therapy services in a clinic or in your home. And a lot of people don't realize that. A lot of people, even some physicians, think that you can only receive outpatient services in a clinic. They think that if you're in the home, you're receiving home health, and home health therapy is under Medicare Part A. That's not the case. I'm a home health and Medicare Part B provider. I understand the guidelines and the regulations very well. You as a Medicare beneficiary are absolutely allowed to receive outpatient therapy services in the home under Medicare Part B. So what you would do if that's something you want to pursue is you would start to look at local providers. You would contact any of the local physical therapy clinics. You would ask if they offer specifically outpatient in the home. If there's a therapist that can come to your home, provide outpatient services under Medicare Part B. There are a lot of private operators out there. They use the terminology mobile physical therapy because they're mobile providers. They come to your house, they provide services in your home. And it's a really, really great benefit, especially for those of you who, even if you decide you do want to go to outpatient therapy in a clinic, but let's say for the first week, 2 weeks, 6 weeks, you're not allowed to drive. If you're in a situation where you're not able to drive, you're not able to get a ride, or it's inconvenient, you can absolutely start with a mobile therapist, a therapist that's contracted with Medicare, who could provide outpatient services in your home, and then transition to an in-the-clinic outpatient provider. They don't have to be the same company. They don't have to be the same organization. I frequently work with clients on multiple levels when it comes to this. I've had clients that are unable to come to the clinic, so I go to their home under Medicare Part B. Most of my time is spent in the clinic. I've had other therapists who are Part B providers start the patient care in the home, then transition the patient to my clinic. We're completely separate business entities. So there are lots of opportunities for you. The final part that I want to bring in here is something to consider. Effective right now and through the end of 2020, Medicare is covering telehealth physical therapy. So telehealth could be a video just like this, but it's in real time. If you're familiar with FaceTime, if you're familiar with a Zoom call, certainly there are platforms that you can use with a therapy provider. And what's so amazing about the telehealth experience is, once again, you can kind of craft your own patient plan of care. And what I mean by that is, let's say you're located here in Ohio. I am a Medicare provider here in Ohio. I can do an initial evaluation. I can provide physical therapy services to you through a telehealth platform if you live too far from my clinic. But you can also go to a local provider so that you get the best of both worlds. You see somebody like me who's more of a specialist in total knee replacement, and you get the day-to-day treatment at a local clinic because they have the equipment, they have the place, and hopefully they have the therapy staff in place that you like and that you work well with. So guys, the bottom line is there are lots of opportunities for you. Don't ever feel pressured. Don't ever feel compelled. If you want a therapist to come to your home, you can make it happen. If you don't know how to find an outpatient Part B provider who can come to your home, post a question in the YouTube comments. I will find one for you because I've got a network of thousands of therapists all across the country. We all communicate, we all keep in touch, and we know who are the good ones and maybe who are not so good. So I'm more than happy to help you out. Make some recommendations, send some names your way if you're looking for outpatient services in the home. If you're looking for telehealth, let me know that also. Post your comments and I'll do my best to find somebody who's doing telehealth in your state. But do not hesitate to find the best provider. You know, you're in charge. This is your healthcare. This is your need. You want to find a person you like, you trust, and that you can build a long-term relationship with. All right, guys, I hope that answers your question. If you post your questions in the Facebook group and I have the opportunity, I love to answer your questions. So tag me on it and I'll get you a video just as soon as I can. Thanks so much, guys. I'll catch you next time.